right, Dr. Emer, we are live.
Hey guys, happy Monday. We're here in the OR, and on Jason MRMD, we're doing a staged procedure, part 2 of one of our patients from last week who had a body lift with myself and Dr. Rojas. We are now working on lipoing his calves and arms in preparation for his second surgery cutting today, which is going to be the chest lift and the arm lift. So you guys could see with Renuvion, very rarely do you guys actually see this on the calves. This is a guy that lost a lot of weight, who also has excess fat in that area. So we are working to tighten the skin after we removed fat. He actually has very large muscles, so you don't want to remove. You can see there's not much fat that's here anymore. But we're working on his ankles, tightening those ankles, tightening the calves. And this is Renuvion plasma. So for those that don't know about it, the gold standard for liposuction nowadays is to remove fat but also tighten the skin. And so this is contracting internally the tissue so that we get a better contour, we get a smoother result, and we get a tighter, longer lasting result. And so under the skin, there's this flame, and you can see it here, right there. And it's tightening, basically contracting the tissue underneath. And this is going to be done in multiple passes so that we can get a very smooth look. What do people normally ask about Renuvion? Zach, anything good?
They want to know, can you get this done without lipo?
Usually no, you guys. It's very important. Even micro lipo needs to be done. That's why I call it liposuction with heating, because you really do need to create a layer, a vector, a plane that this can go through that doesn't have much fat. Now, if you don't have much fat, like a very thin supermodel woman that we talk about wants skin tightening, you still need to do something to kind of open the plane, which is why we have to do that also. Look at about 1900, which is also why we need to do that on the neck and other areas where you might just want tightening, but we need to do a little bit of extraction or creating that contour. So we're doing that today. We did the lipo first.
Is this going to show immediate results?
No, this is something that takes multiple months to see. The good thing about this, and this can actually tighten up to a year after surgery, you guys. So I always tell people, diet, exercise, and peptides as much as you possibly can do after surgery to get more tightening. The peptide therapies will decrease the swelling more quickly, especially the BPC 157, MK 677. Those will help a lot in the healing phase, and CJC, ipamorelin, can help with the muscle defining.
Do any peptides help with skin tightening?
They do. There's one specifically, GHK copper. There's a couple others, but this is the one that does the most in terms of collagen production and skin brightening. For those that have surgery, it's good to be on that because it can prevent hyperpigmentation in your scars if you're doing any cutting or even little marks, like I'm doing these entrance sites, for example. So you can hear the contraction. That's what's amazing about this procedure versus another competitor device, let's say Body Tight, which requires temperature to get the tightening. This doesn't require a certain amount of energy. This requires a certain number of passes to get contraction. And you can actually physically hear it and sometimes even smell it because it's releasing smoke and char.
Someone wants to know, what does it
Smell,
smell like?
I love it because it smells like a barbecue. Unless anyone else would say something else different. I feel like it smells like a barbecue when it's working for sure. So that's Renuvion, you guys. We're going to continue this calf contouring and arm and chest lifting procedure. So make sure to follow along on Snap and Jason MRMD.